All right. Hello, everyone. Thank you for joining us today. The webinar is going to start really soon. Over the course of this broadcast, if you have some questions, please just go to the chat section down at the bottom, type in your thoughts, and make sure to hit the send button. I know that seems obvious, but we all forget every now and then. And we will be monitoring those questions, and we'll do our best to get to them at the end of our session. So on behalf of Burns & Wilcox, I'd like to welcome you to our webinar today. My name is Laura McCormick. I'm a professional practice group leader for Burns & Wilcox. I sit in the Dallas-Fort Worth office. I'm joined today by two of my colleagues, Carl Olson, who is Vice President of Professional and Management Liability Practice Leader with Burns & Wilcox Brokerage. He sits in the San Francisco, California office, and we also have Evan Miller on the line as well, and he's a broker for professional liability in our Chicago office. Both of these gentlemen have years and years of experience within the healthcare industry as well as professional liability in the healthcare space. So with that being said, we're going to get started here. As you all know, there's a lot going on in the healthcare landscape with telehealth leading the pack with advancements. Today's webinar, we're going to talk about the challenges within the healthcare marketplace and what's driving current market conditions relative to telemedicine. We will also walk through tips for our agents and brokers and things for them to think about relative to overall solutions. To get us started today, Evan, can you give us a summary of what telemedicine actually encompasses?
Yeah, absolutely. And thanks everybody for taking time to be here today. I think at its core, telehealth and telemedicine can be defined as the use of telecommunications platforms as a vehicle for healthcare providers of all types to conveniently connect with their patients, be it physicians, nurses, pharmacists, or even social workers. However, in a space as robust and innovative as healthcare, a definition that simple doesn't do it proper justice, in my opinion. While telehealth often conjures up an image of a simple doctor-patient consultation, we're now also seeing it pop up in new and cool ways in 2024, like the use of artificial intelligence to triage patient conditions, apps and software platforms designed to aid customers and patients in maintaining healthy lifestyles, wearable devices being used for the purposes of remote patient monitoring, and even things like the use of augmented reality to aid medical training. So evolution in the space has happened quickly, as we all know, and will only continue to adapt and evolve in coming years, making this a really dynamic and exciting space to be a part of.
Yeah, there really is a lot going on. I think about the wearable devices have really changed how care is delivered. You know, you think of diabetics and such. So thank you for that, Evan. Carl, can you give us a rundown on how this fits into the delivery of care these days?
Certainly. Thank you, Laura. And thank you again for everybody attending today. Telehealth can be used for various services, including appointments to diagnose common illnesses or infections, follow-up visits after procedures or hospitalizations, certain therapies, or even management for chronic conditions. We all know the COVID pandemic led to an increase in telemedicine, and with both patients and physicians, where physicians went from about 15% in 2019 up to 86% in 2021. In 2021, telehealth was used by more than 17% of American patients, which exceeded 200 million visits. About 37% of people over 18 rely on telemedicine within the last year. And for 2023, the telehealth industry exceeded $194 billion in market value.
Wow, that's a lot. So thank you for that. As insurance brokers, what are the market challenges for us, Evan? Where's the coverage for this?
Yeah, so that's a great question, and to that I would say telehealth much like a traditional medical malpractice policy, is going to respond to bodily injury ultimately. But the snag there is that in telehealth, bodily injury may arise from very non-traditional methods in terms of comparison to traditional medical malpractice. Some examples of that place where contingent bodily injury may arise from are technology failure, which leads to a delayed response time or misdiagnosis, business interruptions or cyber events like the ransom attacks you see across the news with increasing frequency, and then also just the failure to adequately assess patient symptoms through a virtual screen here, leading to an incorrect treatment or even a misdiagnosis. Are some common pitfalls where technology leads us to bodily injury at the end of the day.
So
That's interesting you say that, Evan. For telehealth, we have insurance data that shows 25% of telehealth malpractice claims were from the misdiagnosis of cancer. 20% were the misdiagnosis of stroke. And to your point, 20% were the misdiagnosis of infection.
yeah, the misdiagnosis is really concerning because we're only as good as what we tell people, right? So, Carl, with the advancement of telemedicine, how is the market addressing issues within the healthcare provider system as it stands now? Is traditional med-mal covering this exposure?
It is for the most part. And I think there's the myth that your medical professional liability policy won't apply to it, but there are some certain challenges that we'll get to about the provider involvement with telemedicine. But for the most part, it's being adopted within the industry. It does address things like scope creep, where you see nurses or physician's assistants and the expansion of what they're able to provide or do in a medical interaction setting. And telemedicine is enabling that, which does create efficiencies. But to be clear, telemedicine is more than just the virtual visits. There's a certain evolution of telemedicine. And really, I think there are three categories to look at. One is in the administrative support arena, where you have the patient interaction to a portal or a platform to make an appointment, to conduct a copay, to look at their own patient file, their electronic medical record. Then you also, and in the industry, they call it by two things, synchronous and asynchronous. So synchronous would be the real-time interaction, and that's your typical virtual visits for video or remote monitoring. Asynchronous is the interesting store and forward concept, where people can submit images to be reviewed later, provide a text message or platform communication to a chatbot, or even via email sometimes, but then also in the background too. There's provider to provider interaction where they can get secondary opinions. And while I'd say that there are many advantages of telemedicine, there are headwinds and there are challenges in the deployment.
Yeah, I mean, you just think about all that information sitting out there, all your health information, it's all in that one place. It's a little frightening. Remember back in the day, you never wanted to even give out your social security number, and things are different. Evan, understanding this, let's talk about some of the challenges that telemedicine presents.
Yeah, so I think in terms of challenges, we saw telemedicine in some way, shape, or form has been around for a long time. And in terms of challenges, we really saw the 2020 COVID-19 pandemic accelerate the adoption of telemedicine. And there certainly were some challenges that came along with that. But that is really kind of the event, as we all know, that acted as the catalyst to getting us from the pre-pandemic world of telemedicine to where we stand today, where oftentimes these things are involved in a hybrid capacity. Because, in that era, both medical provider and patient were concerned about contracting COVID, so that it drove an increase in adoption in terms of virtual visits. There were also just packed hospitals and packed emergency rooms at that point in time, and people wary of at worst, not able to at worst of making it to a hospital. So really kind of spurred the growth and adoption of telehealth and got us to where we stand today, where it's really a ubiquitous part of the American healthcare system. And as a matter of fact, Laura, know that prior to the pandemic, and this is according to the NPJ Digital Medicine, only 27% of clinical professionals actually were rendering telehealth services prior to the COVID-19 pandemic. So we've certainly seen a mass adoption since then, and it'll only continue to adapt and evolve.
Yeah, I mean, it's an ease of doing business, right? And if you can do it real quick over a call, it's easier. So Evan, from your from the patient's perspective, what's the downside of telemedicine?
Yeah, well, I think there are, from the patient perspective, upsides and downsides, to give both sides of the coin here. I think in terms of upsides, we're seeing access to medical care in places where that was previously challenged, be that rural America or developing countries. These folks are now in a position to receive health care that previously may have been unattainable or a several hours drive away. So I think that's certainly an upside. In terms of the downside, there is just kind of, there's a lack of a relationship. Sometimes there's an uneasiness in not having the same medical provider that you're used to. You're not exactly sure who's on the other line or who you'll be talking with, and there's just that lack of comfortability. And then also we just kind of see certain specialties in the medical world are not necessarily suited to telehealth. I mean, surgery via telehealth is not something that I would recommend. I'll leave it at
that. We were kind of chatting about that the other day, like these virtual hospitals and virtual robotic surgery. To me, is frightening. Carl, your thoughts? Help or hinder? What's the downside of telemedicine from the provider perspective?
Certainly, I think with the adoption and the accelerated growth of telemedicine within healthcare, most physicians are on board with it. But there's a few ways to dissect that. So from addressing the administrative burden that goes onto healthcare providers, telemedicine and the administrative support that some of the systems can provide greatly eases, well, maybe not greatly, but it should improve physician or nurse provider burnout, let's call it, just by creating efficiencies in the administrative burdens and the responsibilities that they have. There are systems now that can support better scheduling, so they know that a nurse, that the nurse's staffing levels are appropriate. The level of care that's being provided then can be addressed more efficiently. But we also know that there are certain specialties where telemedicine is not appropriate. Your generalists or your family care or your primary care physicians have a greater adoption rate, and also will, via surveys, say that about 77% of primary care physicians believe that they can provide equal to or better medical care when telemedicine is involved. There are certain medical specialties that also feel that way and align with that. But when it comes to surgical specialists, they're more likely to indicate that telemedicine does not enhance their practice. 49% will say that they would use it comfortably, and there's a time and a place for it, and certainly when it doesn't work, it doesn't work. As Evan mentioned, COVID had a great impact on the adoption and the utilization of telemedicine. We know since then things have changed a little bit for that industry, for the healthcare industry. An example of that is Teladoc, which is a publicly traded company. In February, after an earnings call, their stock price dropped 46%. And 25%, and that was because their utilization of their support of telehealth visits fell 46% in 2023. So there is a backing away a little bit of it, where people are more inclined post-COVID to go to the urgent care clinic. The ERs are not as overrun, hopefully, and so the people are more inclined to do that versus look to a televisit as their first interaction. We also know that there's more recent data from the CMS, which runs Medicare, Medicaid, and they saw that Medicare beneficiaries who used at least one telehealth service fell 73% in the third quarter, fourth quarter of 2023. So there are ebbs and flows of utilization, and telemedicine does remain relevant, and it's certainly moving healthcare forward. And while I mentioned the teledoc situation, we also know that healthcare executives want to make investments in telemedicine and certainly work towards the evolution and integration of generative artificial intelligence.
Yeah. So I'm just thinking back to your comment about easing the physician burnout and that being a benefit. When you look at traditional medical malpractice, from an underwriting perspective, we've been seeing those rates really tighten up, and the underwriters and actuaries, for that matter, they have concern about less qualified physicians going to, they're phasing out because they are completely so stressed out, they just can't handle it. So this might be something with the evolution of telemedicine. Hopefully, maybe that will relieve some of the concerns on that side to get, stabilize the med mal rates. Anyway, with all of this in mind, as insurance professionals, what are we faced with? Evan, do you want to start us off there? Some of the emerging issues?
Yeah, I think on its surface, telehealth is a medical industry at the end of the day. There's still a relationship between a patient and a medical provider here, where there's a true medical liability component involved. But you take one step back and you realize that this is equally a technology-based industry as well. So the need to have proper insurance on both of those exposures, being the actual medical work being rendered and then the technology component of having all of your systems covered and those exposures as well, because as it was alluded to earlier, I mean, there's very sensitive data being stored on all of these systems, and there are bad actors out there who are looking to take advantage of and hold some of that stuff for ransom. So this is truly an intertwining of medical and technology, which from an insurance standpoint is something that the industry hadn't really seen up until probably 10, 15 years ago. And solutions are being created to address these issues. And it's just important for all insurance professionals to understand the kind of intertwining of those exposures and making sure that things are properly squared away on all fronts.
Yeah, and to kind of augment that point about the technology point, some of these, family practitioners, they might say that they aren't practicing telemedicine per se, but I think that 99% of those offices on the administrative side, they're sharing information via their portal. So it's huge exposure. So Carl, you mentioned AI earlier, and let's talk about that. There's a lot to unpack there. So let's get started on it because everybody wants to hear.
It is, it's an interesting one. And building off of Evan's point, telemedicine really does bring technology to the forefront when we're dealing with the healthcare industry. And now within the last year and a half or so, there's this whole concept of generative AI, which has been around for a longer time, but places like ChatGPT bringing it more to the forefront. But we also have, big tech, Google, Amazon, Oracle, Microsoft. They are all creating healthcare industry initiatives and products for generative AI. but there's some important things to know about it. I mean, the adoption of into healthcare, that's a hard one to talk about at this point because it is all just, it's still in development. You know, we know that a lot of people are interested in it. A lot of people are talking about it. I really doubt that we're anywhere near any sort of chatbot creating any diagnosis for us. I hope we're really far away from that. But the collection of data is the important piece, right? And then the enabling of a patient-provider interaction, certainly important. But when we're talking about AI, either augmented intelligence or generative artificial intelligence, those two aren't interchangeable concepts, but they align. So I'll just say AI. There are a few things that are affecting the adoption into the healthcare industry. Number one is sort of the end user understanding of how AI can work, what information they provide and how that could be used. There's bias in AI models, you know, the global collection of data and then how that gets interpreted. You know, there's still some troubles in that. And then there's a whole concept of AI hallucinations, which is really, it creates, you know, AI creates some sort of output that is not based in reality. So then you have the liability resulting from these inaccuracies. And if you have an inability to identify that an output is just way off base. But, you know, obviously this is an area where it's being worked on and there's a lot of developments. So you have coding and payment systems being built into AI, creating some efficiencies, hopefully. And there's also just the generation of all this additional data, which creates a privacy and security concern. You know, obviously HIPAA and a lot of regulations exist, plus best business practices surround network security and limiting the use and access of information. But when you open things up to AI, there are no walls. We don't really know where that information is going to be processed, which then means the regulatory landscape supporting AI it's not quite there yet. We don't know. And for as much as you know, in the European Union, they've made limitations around ChatGPT. There's been talk about it over here, obviously, but we don't know. And healthcare is such a highly regulated industry. It's either going to, well, the adoption of AI will be greatly impacted by what regulatory response occurs.
Gotcha. Yeah, it's a long road for sure. So Evan, we recently in the news, we've been hearing a lot about some significant claims within the healthcare sector. You have some comments for us?
Yeah, absolutely. There's a pretty timely example here, or cautionary tale perhaps is a better phrase for it. In my backyard here in Chicago at Lurie's Children's Hospital. So talking about a children's hospital here that was breached by a ransomware attack, which led to the hospital's inability to access patients' medical records. And as you could all imagine, the potential array of outcomes that kind of cascade down from that breach are catastrophic in nature. And actually that outage lasted about a full month. I came to light that Lurie is just now regaining access to their systems. So that's quite some time that they were offline. And as you could imagine, there's likely some bodily injury fallout as a result of them not having access to those patient medical records. And then the kicker on top of all of that is it recently came to light that the medical records were most likely sold off by the bad actors who were responsible for that breach. So it's come up a handful of times already on this call, but there's very sensitive data involved with all of these operations that are providing telecare. And making sure from a cyber and tech standpoint that that's properly insured is crucial because of cautionary tales exactly like this. Carl, did you have any claims examples?
Yeah, no, the one that you brought up is it's really interesting because it involves a lot of exposures and certainly a lot of coverages, right? There's also the probably the biggest healthcare cyber event ongoing that started 3 weeks ago. Change Healthcare. They processed 1 in 3 claims, healthcare claims in the U.S. and they were subject to they were hacked by a ransomware group. They paid about it's reported that they paid a $22 million ransom to get their operations back up and running, which has still not occurred. It's also reported that the lack of Change Healthcare has been able to process anything. It's costing hospitals about $2 billion a week in backed up remuneration and reimbursements. It's pretty phenomenal, the scope and size and reach of just that one event. I did find that the Department of Health and Human Services, the HHS, they issued a report not too long ago saying that there were 630 ransomware events in healthcare last year. And it's a prevalent exposure. So when we're talking about telemedicine and the generation of terabytes of information per patient sometimes, there's a lot of exposure and additional exposure, and the endpoints into all that data grows exponentially. So there are certain insurance industry responses to all of this. I wouldn't want to be necessarily the underwriter on some of these cyber exposures. Hard to measure, but there is a way to do it, and we can certainly get there.
Yeah, a lot of touch points. So keeping all this in mind, as agents and brokers, how do we help make sure that our clients have what they need? There's a whole combination of coverages that we've just been talking about. Evan, where are you coming from on that?
Yeah, so as insurance professionals, it's our job to be identifying the various exposures that pertain to these types of operations as they hit our desks. And as we've kind of touched on here already, this is a very unique blend of intertwined exposures. We have professional liability, general liability, tech errors and omissions, and cyber, all really playing a factor into fully and comprehensively covering a telehealth company's exposures. So it's just important to be able to identify those exposures and work with somebody that is familiar in the industry to help make sure there's proper coverage there.
It's interesting too, Carl, you were mentioning the medical billing aspect. That's a whole nother, separate ball of wax too, and the med mal, yeah. Carl, your thoughts on that?
Well, to put a little more framing around what we're talking about today, as we're nearing the end of our time, we know that 90% of hospitals use an EMR system, right? We have, so when we're talking about telemedicine, we have platforms for engaging provider-patient interaction. We have platforms that are supporting the administrative side of healthcare. It's creating efficiencies in the management of medical care. So I talked about staffing or appointments or healthcare benefit review. We have telemedicine involved in monitoring a patient population, where it can either be that critical or chronic care, such as diabetes. We have case or care management, and we have risks where they monitor post-procedure follow-up care. And most of what telemedicine can support on the post-procedure side is obviously to reduce readmission, which can be very expensive, and also maintain or improve accuracy of medications. Just yesterday, the AMA dropped an updated digital health resources guide to provide, well, provide guidance for digitally enabled care. Which leads to, and to wrap some of this up, Evan, do you want to talk about how we can put all this together? What type of applications and what type of information we need, and how we can best support our conversations with underwriters?
Yeah, so in response to the unique blend of exposures that accompany and are associated with this industry, many of our carrier partners have developed applications specifically tailored to this type of business. So we're always happy to facilitate that and get that in your hands, the retail agent, so that we can comprehensively review a risk with you guys. The important things to get a firm grasp on in terms of our exposures here is what the scope of the services being provided, exactly what type of telemedicine they're venturing into, or types, who will be providing the services and what software platforms, et cetera, are involved in that. And then also who's the end customer, right? That's also important for carriers to know, just to kind of get a comprehensive overview of our exposures here. So getting that comprehensive outlook is usually pretty easy once we have one of these applications completed, and from there we're off and running.
Yeah, definitely demonstrates the importance of getting as much information as you possibly can about the whole scope of services that are being offered from the beginning to the end. So that's been really informative, guys. Thank you so much. I do have a couple of questions popping up, so this is exciting. First one here is, how does telemedicine affect the cost of delivery? Is that going to make telemedicine more attractive? Thoughts on that?
Sure, I have a couple thoughts on that. I think the cost of delivery to the patient, usually a telemedicine visit is going to be supported by, if you're a Medicare, Medicaid patient, or covered by a commercial health plan. Telemedicine is usually going to be a covered benefit, and your copay on something like that can range from like $5 to $30, right? Versus going to an urgent care clinic that might be, $50 to $100, or emergency room visit that's either, sometimes there's no copay, but sometimes it can be, pretty high, and you incur a lot of expense. And so, in addition to, not having to drive anywhere, you can usually do some sort of telehealth visit, from a phone or computer, wherever you are. It's a more cost-effective way of receiving medical care.
So you just said wherever you are, which leads to another question that popped in, that interstate providing of coverages. We have, since you don't have to go into the office, you don't have to go to the care facility, you might be a physician or a provider might be corresponding and having a visit with somebody that's in a different state. As brokers and agents, what needs to be addressed there?
Yeah, I'm happy to field this one. So part of the beauty of the advancements of technology that kind of have facilitated this industry are the fact that we can have a doctor in Kansas providing care to a patient and sitting in Colorado, and that's now attainable. So the ability for that to exist is pretty incredible, in my opinion. But that being said, there are certainly things to keep in mind in regards to what your policy's coverage territory is. And the states involves license and requirements for telemedicine. I do know that oftentimes medical providers are required to be licensed in the state in which their patient sits. So that's certainly an important thing to keep in mind. And then there's also the matter of international care. So not all policies have a true worldwide coverage territory. So it is just important, again, when it comes to us getting a comprehensive understanding of the risk, what the plans are there for the location of the customer base, really, and what the kind of business plan is in regards to addressing that.
So does that happen on a state-by-state basis with the licensure, or is Do you happen to know?
Yeah, correct. So 50 different states, 50 different sets of rules on this type of stuff.
Yeah.
Yeah, so that's on a state by state
Whole
basis.
insurance, there's no yes or no answer, right?
Precisely, yeah.
Do you guys know overall if most health insurance covers telemedicine? Do you think that's a predominantly yes or no? I got it. Nod.
Yeah, no, I mentioned before, I think it for the most part is just varying degrees of, that initial checking in, or making an appointment.
Mhm.
Those types of platforms, a lot more medical groups or facilities are including that type of capability. So it might be a business expense to that medical group, but it's something afforded to the patient. And then, teleradiology services, teledermatology. There's a lot of different specialties. Some counseling services. Those are certainly universally adopted.
Good. So I think you mentioned earlier, Carl, statistics about the usage of telemedicine is on the increase with the aging population.
Mm-hmm.
So I'm curious, typically health insurance is more expensive for the older you get because you tend to get into the age where there's going to be chronic care type issues. Do you think that will affect with telemedicine and more of the aging population using it? Is that going to affect the claims at all? Do you have any opinion on that?
Yeah, there's a really interesting phenomenon that the older a patient is, the more likely they are to use or have a telemedicine visit. And contrary to what you would think about, the older you get, the
Yeah, you don't want to try something new.
less flexible around medical care might be, but the older you are, the more likely you would be to receive care via telemedicine. It does bring about the greater concern for different type of claim, right? So Evan mentioned that as a patient, you might see a physician that you don't know who they are, right? And when there's a lack of relationship there, that affects claims and how they can be brought, or what allegations might be involved in that matter. But as far as claims data or eventual outcomes, I haven't seen anything yet where anybody's really studied that.
Okay, it'll be interesting to see, and I'm sure with the chronic care as you get older, the wearables are really helping drive people to a virtual type, visit. So this has all been really fantastic. Do you guys have anything else you want to cover real quick before we close out? We're getting up there on time. My thoughts are that this landscape is going to continue to advance 2024 and moving forward. So we need to keep our eyes and ears peeled. For the audience, as you can see, these guys are very well versed in this and they deal with it day in and day out. So they're available to answer any questions, and we're here to help. So with that being said, I will wish everyone a wonderful afternoon. And Carl and Evan, thank you so much for your time. It was very well informed, and appreciate it.
Yeah, thank you. Appreciate it.